Question 1. A child's hitting behavior is currently maintained by escaping difficult tasks. You implement a differential reinforcement procedure, DRA, where you reinforce the child for appropriately requesting a break. Break, please. After a few weeks, hitting decreases significantly and requesting breaks increases. However, you notice that when the child is not being asked to do difficult tasks, example during free play, they now occasionally request breaks unnecessarily. This phenomenon, where the rate of the alternative behavior increases in a non-training context, could be related to A. Extinction burst, B. Spontaneous recovery, C. Behavioral contrast, D. Response induction. Answer: C. Behavioral contrast. Explanation: this question describes a complex scenario related to behavioral contrast. Behavioral contrast happens when a change in the rate of a behavior in one setting or condition, example, hitting decreasing during tasks due to the new DRA/extinction for hitting, is accompanied by a change in the opposite direction in another setting or condition where the intervention is not in place, example, inappropriate break requests increasing during free play. The child learned requesting breaks is effective, and suppressing hitting during tasks might make the requesting behavior spill over or occur more often inappropriately when escape is less likely to be needed. Extinction burst and spontaneous recovery relate to the problem behavior itself. Response induction is about new behaviors appearing. This inverse relationship across settings points to behavioral contrast. Question 2. When reviewing a behavior definition, describing a child's tantrum as when the child is upset, cries loudly for more than 1 minute, and drops to the floor includes components that are problematic because A. Cries loudly is not observable. B. Upset is not observable and measurable. C. Drops to the floor is not measurable. D. More than 1 minute is not a clear criterion. Answer: B. Upset is not observable and measurable. Explanation: this question tests your understanding of writing objective behavior definitions. A good definition must describe behavior in terms that anyone can see or hear and measure consistently. While cries loudly might be debatable on clarity without a specific threshold, upset is clearly an internal state or interpretation of emotion that cannot be directly observed or measured by someone else. You can't see or measure upset. Drops to the floor is observable, and more than 1 minute is a measurable duration criterion. The primary flaw is including a subjective, unobservable term like upset. Stick to actions and movements you can see. Question 3. You are asked to measure a client's compliance with instructions. You record the time from when you give an instruction until the client begins to follow it. You are also asked to record how long it takes for the client to complete the instruction once they start. Which two dimensions of behavior are you measuring? A. Frequency and duration. B. Latency and duration. C. Frequency and latency. D. Duration and interresponse time. Answer: B. Latency and duration. Explanation: this question asks you to identify two different measurement dimensions being used. The first measure, time from when you give an instruction until the client begins to follow it, is the definition of latency, time to start after a stimulus. The second measure, how long it takes for the client to complete the instruction once they start, is the definition of duration, how long the behavior occurs from start to finish. Frequency is the count, and IRT is time between instances. This scenario requires measuring both the time it takes to start and how long it lasts. Question 4. A type of motivating operation, MO, that acquires its effectiveness by being paired with an unconditioned punishing stimulus is called A. Unconditioned motivating operation, UMO. B. Conditioned motivating operation, reflexive, CMOR. C. Conditioned motivating operation, transitive, CMOT. D. Conditioned motivating operation, surrogate, CMOS. Answer: B. Conditioned motivating operation, reflexive, CMOR. Explanation. This question asks about a specific type of conditioned motivating operation, CMO. A CMOR acquires its MO effectiveness because it has been paired with a punishing stimulus and now signals that improvement in that punishing condition via a specific response is possible. Essentially, it signals that a response will prevent or reduce a painful/aversive situation. For example, seeing police lights, paired with getting a ticket/punishment, might function as a CMOR that makes slowing down reinforcing, reduces likelihood of punishment. UMMOs are unlearned. CMOT relates to things needed to access a reinforcer. CMOS substitutes for another MO. Paired with a punisher points to CMOR. Question 5. When interpreting a single subject design graph, a primary visual analysis factor to consider when determining if an intervention was effective is A. The height of the x-axis. B. The consistency of the data collector. C. The immediacy of the change in level or trend between phases. D. The social significance of the behavior. Answer. C. The immediacy of the change in level or trend between phases. Explanation. This question asks about visual analysis of graphs, a key skill for assessing intervention effectiveness. When looking at data across phases, like baseline and intervention, you look for visual evidence of a functional relationship. One important factor is the immediacy with which the behavior changes in level or trendy as soon as the intervention is introduced. An immediate and significant change occurring right at the phase line provides stronger evidence that the intervention caused the change than a gradual change or one that happens much later. The x-axis height, A, is not a visual analysis factor for effectiveness. Consistency, B, and social significance, D, are important but are not direct factors in visual analysis of the graph's effect. Question 6. You are teaching a child to assemble a puzzle using a task analysis. You provide prompts for any steps the child can't do and reinforce them for completing the entire puzzle. You repeat this process until they can do the whole puzzle independently. This teaching method is called A. Forward chaining. B. Backward chaining. C. Total task presentation. D. Shaping. Answer. C. Total task presentation. Explanation. This question describes the total task presentation chaining procedure. In this method, you break the skill into steps using a task analysis, and then on each teaching trial, you require the learner to perform all steps of the chain from beginning to end, providing prompts as needed for any steps they can't do. Reinforcement is typically delivered only after the successful completion of the entire sequence. Forward chaining teaches from the first step, backward chaining from the last. Shaping teaches the single behavior. Total task presentation teaches the whole sequence in each trial. Question 7. A child's hitting behavior is maintained by getting attention from their peers. You implement a plan where peers are instructed to ignore hitting, extinction of attention, and the child is taught and reinforced for tapping peers on the shoulder for attention. DRA. After implementation, hitting decreases, but you notice the child now engages in a lot more crying. The crying is likely an example of A. Generalization. B. An extinction burst phenomenon. C. A result of negative reinforcement. D. A desired replacement behavior. Answer. B. An extinction burst phenomenon. Explanation. This scenario describes an extinction burst, often accompanied by increased response variability. When the previously reinforced behavior, hitting, is put on extinction, peers ignore it. You might see a temporary increase in that behavior, not described here, and the emergence of new behaviors, like crying, that the individual tries in an attempt to regain the lost reinforcement, attention. This increased variability and emergence of new behaviors is a characteristic part of the extinction burst process, as the learner's behavior becomes more variable when the old strategy stops working. Generalization, negative reinforcement, or a desired behavior don't fit this pattern of a temporary increase in unwanted/new behaviors after reinforcement is removed. Question 8. When reviewing client data, you calculate that two independent observers recorded the same behavior occurring 85% of the time compared to each other's records. This indicates A. The behavior definition is unclear. B. High treatment integrity. C. High inter-observer agreement. D. The intervention is effective. Answer C. High inter-observer agreement. Explanation. This question is about inter-observer agreement, IOA. IOA is a measure of the reliability of data collection. It involves having two or more independent observers measure the same behavior simultaneously and then calculating the percentage of time their recordings match. An 85% agreement indicates a high level of consistency between the observers, suggesting that the data is reliable. It doesn't directly assess the clarity of the definition, though high IOA suggests it's likely clear. Treatment integrity, how accurately the intervention was implemented, or effectiveness of the intervention. IOA specifically measures the agreement between observers' data. Question 9. A practitioner is using a variable ratio 5, VR5, schedule of reinforcement. This means reinforcement is delivered after A. Exactly 5 minutes have passed. B. Exactly 5 responses have occurred. C. The first response after an average of 5 minutes have passed. D. An average of 5 responses have occurred. Answer D. An average of 5 responses have occurred. Explanation. This question asks about interpreting a variable ratio, VR, schedule notation. In a VR schedule, reinforcement is delivered after a varying or unpredictable number of responses. The number, in this case 5, indicates the average number of responses required across several trials. So, a VR5 means reinforcement is delivered after, on average, 5 responses. Fixed schedules, FR, FI, use exact numbers or times. Interval schedules, phi, VI, are based on time, not number of responses. Variable ratio is about the average number of responses. Question 10. Which ethical principle requires behavior analysts to prioritize the client's best interests and well-being? A. Integrity. B. Non-maleficence. C. Justice. D. Beneficence. Answer D. Beneficence. Explanation. This question asks about the ethical principle of beneficence. Beneficence means actively working for the good of others and promoting client welfare. It is the ethical duty to help and to contribute to the well-being of those we serve. Integrity is about honesty. Non-maleficence is about avoiding harm. Justice relates to fairness and equitable access. Beneficence is the principle of doing good and promoting the client's interests. Question 11. You are supervising a newly certified BCBA. Your ethical responsibilities as a supervisor include A. Ensuring their continuous professional development and adherence to ethical codes. B. Taking over their difficult cases to reduce their workload. C. Charging a percentage of their client billings for supervision. D. Limiting the types of clients they can serve indefinitely. Answer A. Ensuring their continuous professional development and adherence to ethical codes. Explanation. This question addresses the ethical responsibilities of supervision. Supervisors have a duty to ensure that their supervisees, including newly certified practitioners, continue to develop their skills and knowledge, maintain competence, and practice ethically. This involves providing guidance, feedback, and mentorship. Taking over cases, B, doesn't promote their growth. Charging a percentage of billings, C, can be an ethical issue related to financial conflicts. Limiting practice indefinitely, D, without a clear plan for growth, is not the purpose of supervision. A core role is supporting their ongoing professional and ethical growth. Question 12. A child is taught to identify shapes, circle, square, triangle, when presented individually. Later, they are shown a page with many shapes and asked to circle the squares. They are unable to do this consistently. This may indicate a deficit in A. Simple discrimination. B. Conditional discrimination. C. Stimulus generalization. D. Response generalization. Answer: B. Conditional discrimination. Explanation: this scenario describes a deficit in conditional discrimination. Simple discrimination is responding differently to different stimuli, presented individually, example saying square when shown just a square. Conditional discrimination involves a response to a stimulus being conditional on the presence of a third stimulus. In this case, the child can identify shapes. Simple discrimination may be present, but they struggle when the response, circling, must be conditional on a verbal cue, circle the squares, telling them which shape to select or mark from an array. The response depends on the condition provided by the instruction. Question 13. When implementing an extinction procedure, it is critical to identify and control the reinforcer that is maintaining the problem behavior. If the maintaining reinforcer is not withheld, what is likely to happen to the behavior? A. It will decrease rapidly. B. It will remain unchanged or continue to occur. C. It will immediately stop. D. It will generalize to other settings. Answer: B. It will remain unchanged or continue to occur. Explanation: this question highlights a crucial factor for extinction effectiveness. Extinction only works if you correctly identify the specific reinforcer that is maintaining the problem behavior and consistently stop providing it contingent on that behavior. If you don't withhold the correct reinforcer, the behavior will continue to be reinforced and will not decrease. It will remain unchanged or may even increase. Ignoring behavior maintained by escape won't extinguish it. You must stop the specific payoff. If the reinforcer is still happening, extinction isn't happening, and the behavior won't stop. Question 14. Which type of verbal behavior is controlled by a nonverbal stimulus, example seeing an object, and is reinforced by generalized conditioned reinforcement, example praise? A. Mand. B. Tact. C. Echoic. D. Intraverbal. Answer: B. Tact. Explanation: this question defines a tact. A tact is a verbal response that is labeling or naming something in the environment based on your senses: seeing, hearing, smelling, tasting, touching. The control is the nonverbal stimulus, seeing an object, and it's reinforced by generalized reinforcement like praise. That's right, it's a car. A mand is a request controlled by an MO. An echoic is repeating verbal behavior. An intraverbal is responding to verbal behavior without point-to-point correspondence. Seeing and labeling is a tact. Question 15. You are asked to provide services to a client via telehealth, but you are not competent in using the specific technology required safely and effectively. Ethically, you should: A. Accept the case and learn the technology as you go. B. Decline the case or obtain training and supervision specific to the technology before providing services. C. Accept the case but inform the client that you are new to using this technology. D. Use a different technology that you are familiar with, even if it's not preferred by the client. Answer: B. Decline the case or obtain training and supervision specific to the technology before providing services. Explanation: this question extends the concept of scope of competence to the use of technology in service delivery. Ethical guidelines require behavior analysts to be competent not only in their clinical procedures, but also in the technology they use, especially for telehealth. If you are not competent in using the specific telehealth platform safely and effectively, you should not provide services via that platform until you receive adequate training and or supervision. Accepting the case and learning as you go, A, is unethical when competence is lacking. Informing the client, C, doesn't make you competent. Using a different technology, D, might not meet client needs or ethical guidelines for service delivery standards. Ensure competence in the technology before using it for services. Question 16. When discussing client prognosis, the likely outcome of intervention, behavior analysts should: A. Guarantee specific outcomes and timelines to motivate the family. B. Be honest and realistic based on assessment data and scientific literature. C. Downplay potential risks to avoid discouraging the family. D. Discuss prognosis only with other professionals, not the family. Answer. B. Be honest and realistic based on assessment data and scientific literature. Explanation. This question addresses ethical communication regarding prognosis. Behavior analysts have an ethical responsibility to be truthful and accurate. Integrity. When discussing potential outcomes with clients and their families, this means basing your statements on objective assessment data for the specific client and general scientific findings for similar cases, being realistic about what might be achieved and how long it might take. Guaranteeing outcomes, A, is unethical. Downplaying risks, C, violates non-maleficence and integrity. Discussing prognosis only with professionals, D, denies the family crucial information. Be honest and realistic based on the evidence. Question 17. A practitioner begins providing behavior services to a client without completing a comprehensive assessment first. This could be a violation of which ethical principle? A. Confidentiality. B. Informed consent. C. Responsible conduct/professionalism. D. Justice. Answer. C. Responsible conduct/professionalism. Explanation. This question addresses the ethical responsibility to conduct appropriate assessments. Ethical guidelines require behavior analysts to conduct thorough assessments, like FBA, skill assessments, preference assessments, to identify the client's needs, strengths, and the variables influencing their behavior before designing and implementing intervention plans. Implementing services without adequate assessment is unprofessional and unlikely to be effective or appropriate, violating the ethical principle of responsible conduct. While it can also impact informed consent, B, as you can't fully explain services, or lead to ineffective treatment, violating beneficence, the most direct principle related to conducting proper professional procedures is responsible conduct. Question 18. You are reviewing a task analysis for teaching hand washing. The steps include 1. Turn on water. 2. Wet hands. 3. Get soap. 4. Rub hands. 5. Rinse hands. 6. Turn off water. 7. Dry hands. This list of steps is an example of A. A behavior chain. B. A behavioral objective. C. A task analysis. D. A teaching procedure. Answer. C. A task analysis. Explanation. This question defines a task analysis. A task analysis is the process of breaking down a complex skill into a list of smaller sequential steps. The list itself is called the task analysis. A behavior chain is the sequence of behaviors performed, but the list is the TA. A behavioral objective is the overall goal. A teaching procedure, like chaining, is how you use the task analysis to teach the skill. The step-by-step list is the task analysis. Question 19. When graphing behavior data, a clear change in level between baseline and intervention phases refers to A. The overall direction of the data points, increasing or decreasing. B. How much the data points bounce around. C. The average value of the data points in each phase. D. The time it takes for the behavior to start. Answer. C. The average value of the data points in each phase. Explanation. This question asks about interpreting visual data on a graph, specifically the concept of level. In visual analysis, the level of the data refers to the average value of the data points within a specific phase. A change in level between phases means that the average rate, duration, or other measure of the behavior is significantly different in one phase compared to another example. The average frequency is much lower in the intervention phase than in baseline. Trend is the direction. A. Variability is how much points bounce around. B. Latency, D, is a dimension of behavior, not a visual analysis factor. Level is the average score. Question 20. A potential ethical issue arises if a behavior analyst accepts a client referral, primarily because the funding source provides a very high reimbursement rate, rather than based on the client's actual needs and the analyst's ability to provide appropriate services. This relates primarily to A. Confidentiality, B. Professional boundaries, C. Conflict of interest, D. Responsible conduct. Answer: C. Conflict of interest. Explanation: this scenario describes a financial conflict of interest. When a professional decision, like accepting a client, is influenced primarily by potential financial gain rather than the client's clinical needs and what is most appropriate for them, it creates a conflict between the professional's duty to the client and their financial self-interest. Ethically, client needs and the ability to provide competent service must be the primary factors in accepting a case, not the reimbursement rate. Question 21. Which experimental design is characterized by a stepwise change in the target behavior criterion for reinforcement? A. Reversal design, B. Multiple baseline design, C. Changing criterion design, D. Alternating treatments design. Answer: C. Changing criterion design. Explanation: this question describes the changing criterion design. In this experimental design, after baseline is established, the intervention is applied, but reinforcement is initially contingent on meeting a very low criterion for the target behavior. Once that criterion is consistently met, the requirement is increased stepwise, and reinforcement is contingent on meeting the new higher criterion, and so on. The behavior is expected to change gradually in response to the changing criterion levels. Reversal designs remove the intervention. Multiple baseline applies it sequentially. Alternating treatments rapidly switch conditions. The gradual, stepwise change in the goal level is unique to the changing criterion design. Question 22. When using a most to least prompting strategy, the practitioner gradually reduces the prompt level. This process of reducing prompts is an example of A. Stimulus control transfer, B. Stimulus generalization, C. Response differentiation, D. Automatic reinforcement. Answer: A. Stimulus control transfer. Explanation: this question links prompting and fading to the concept of stimulus control. The goal of prompting and fading is to transfer stimulus control from the prompt, which initially evokes the correct response, to the natural discriminative stimulus, SD. By gradually removing the prompt, the SD becomes the reliable cue for the behavior. This process is specifically called stimulus control transfer. Control of the behavior moves from the artificial prompt to the natural environmental cue. Generalization is responding to different stimuli. Response differentiation is reinforcing different forms of a response. Automatic reinforcement is internally generated. Question 23. A behavior is considered socially mediated if the consequence maintaining the behavior is A. Produced directly by the behavior itself, B. Delivered by another person, C. Automatic and sensory, D. Related to escaping or avoiding a task. Answer: B. Delivered by another person. Explanation: this question asks about socially mediated consequences and behavior functions. A consequence, and thus the function it maintains, is socially mediated if it is delivered by or involves another person. Attention, positive or negative, access to tangibles provided by someone else, and escape from demands delivered by someone else are all examples of socially mediated functions because the consequence relies on the interaction with another person. Automatic reinforcement is self-produced without others. A C. Escape, D, can be socially mediated or automatic. Socially mediated means another person is involved in delivering the consequence. Question 24. What is the primary ethical responsibility when advertising ABA services? A. To guarantee specific outcomes for potential clients. B. To make claims about effectiveness that are truthful and based on scientific evidence. C. To use testimonials from current clients to build trust. D. To compare your services favorably to other providers without specific data. Answer B. To make claims about effectiveness that are truthful and based on scientific evidence. Explanation. This question addresses ethical requirements for advertising ABA services. Ethical advertising must be accurate and not misleading. Any claims made about the effectiveness of your services must be truthful, based on the principles of behavior analysis, and supported by scientific evidence. Guaranteeing outcomes. A. Is unethical. Using testimonials from current clients. C. Is unethical. Making unsubstantiated comparative claims. D. Is also unethical. Be honest and base your advertising claims on science. Question 25. You are asked to measure a behavior that occurs at a very high continuous rate, like fidgeting or humming. Which direct measurement method might provide the most accurate overall picture of how much this behavior is occurring? A. Frequency. B. Duration. C. Partial interval recording. D. Momentary time sampling. Answer B. Duration. Explanation. This question asks for the most accurate direct measurement for a high-rate continuous behavior. While interval recording, CD, can provide estimates for behaviors difficult to track continuously, the most accurate measure for how much a continuous behavior is occurring is duration. The total time spent engaged in the behavior, frequency. A, is inappropriate for continuous behavior. Latency is time to start. When accuracy is prioritized for a continuous behavior, total duration is the best measure. Question 26. A child learns to request a specific toy by saying, "Toy, please." This request is controlled by their desire for the toy and is reinforced by getting the toy. This is an example of which verbal operant? A. Tact. B. Mand. C. Echoic. D. Intraverbal. Answer B. Mand. Explanation. This question defines a mand. A mand is a verbal response, a request, demand, or command that is controlled by a motivating operation, like wanting the toy, and is reinforced by receiving the specific item or service requested, getting the toy. The clue controlled by their desire for the toy points to the MO, and reinforced by getting the toy points to the specific reinforcement. Seeing the toy and saying toy would be a tact. Repeating toy please would be an echoic. Responding toy to what do you play with would be an intraverbal. Asking for something you want is a mand. Question 27. When writing a behavior objective, specifying the student will raise their hand addresses which part of the objective? A. The condition. B. The criterion. C. The behavior. D. The measurement method. Answer C. The behavior. Explanation. This question asks you to identify which part of a behavior objective is described by the phrase, "The student will raise their hand." This is the behavior component. It specifies the observable and measurable action that you want the student to perform. A complete objective would also include the condition, when / where it should occur, and the criterion, how often / well it needs to happen. Raise their hand describes the specific action. Question 28. A behavior analyst is asked to use a novel, untested intervention procedure. Ethically, they should. A. Use the procedure as long as the family gives consent. B. Use the procedure and collect data carefully to see if it works. C. Refuse to use the procedure and explain the importance of evidence-based practice. D. Use the procedure only under close supervision and with careful monitoring and documentation. Answer D. Use the procedure only under close supervision and with careful monitoring and documentation. Explanation. This question addresses ethical considerations regarding novel or untested interventions. Using procedures without an evidence base carries ethical risks. Non-maleficence, responsible conduct. If a behavior analyst is asked to use a novel procedure, they should not simply use it because consent is given, A, or just see if it works, B. The ethical path involves caution and careful evaluation. If used at all, it should be under strict supervision and with rigorous data collection and analysis to determine its effectiveness and potential risks, treating it as an experimental procedure. Often, the most ethical response is to decline and explain the importance of evidence-based practice, C, but if it is used, it must be done under highly controlled and supervised conditions. Option D reflects the responsible approach if a decision is made to attempt a novel intervention cautiously. Question 29. Which experimental design is best suited for comparing the effects of two or more different interventions on a single behavior by rapidly switching between conditions across sessions? A. Reversal design. B. Multiple baseline design. C. Changing criterion design. D. Alternating treatments design. Answer D. Alternating treatments design. Explanation. This question describes the alternating treatments design, also known as multi-element design. In this design, two or more different interventions, and often baseline, are rapidly alternated, typically within the same sessions or across consecutive sessions. This allows for a quick comparison of the effectiveness of different conditions on a single behavior. Reversal, multiple baseline, and changing criterion designs introduce conditions sequentially over time. The rapid switching between conditions is the defining characteristic of the alternating treatments design. Question 30. A child's hitting behavior is maintained by getting access to preferred toys. You implement a plan where hitting no longer results in toy access, extinction. You also teach the child to tap an adult's hand to request the toy and reinforce tapping with toy access, DRA. Which principle is the most likely explanation for why the tapping behavior increases while hitting decreases? A. The Premack principle. B. Spontaneous recovery. C. Differential reinforcement. D. Behavioral contrast. Answer C. Differential reinforcement. Explanation. This scenario is a clear example of differential reinforcement, specifically DRA. Reinforcing an alternative behavior, you are reinforcing the tapping behavior, desired, and putting the hitting behavior, undesired, on extinction, by making tapping the behavior that now results in the desired consequence. Toy access, you are differentially reinforcing tapping over hitting. The increased rate of tapping and decreased rate of hitting is a direct result of this differential consequence delivery. Premack uses activities. Spontaneous recovery is a temporary return of extinguished behavior. Behavioral contrast is change across settings. The increase in one behavior and decrease in another due to different consequences for each is differential reinforcement. Question 31. When using a backward chaining procedure, the last step in the task analysis serves as A. An S delta for the previous step. B. The final consequence for the entire chain. C. An establishing operation, EO, for the previous step. D. A reinforcer for the previous step and an SD for the completion of the chain. Answer D. A reinforcer for the previous step and an SD for the completion of the chain. Explanation. This question delves into the stimulus control within a behavior chain, specifically in backward chaining. In any behavior chain, the completion of one step functions as a conditioned reinforcer for the step that immediately preceded it, because it brings the learner closer to the final reinforcement. Simultaneously, the completion of that step also acts as a discriminative stimulus, SD, that cues the learner to perform the next step in the sequence. In backward chaining, when the learner completes the last step independently, that step's completion is the reinforced behavior, and the result of completing the second to last step is the stimulus, the site of the setup for the last step, that cues the final reinforced step. It's a reinforcer for the step before and the cue for the next action, which is the final step in this case. Question 32. You are working with an adult client with severe intellectual disabilities. When obtaining informed consent for services, you must obtain it from A. The client themselves. B. The client's legal guardian. C. both the client and their legal guardian. D, the client themselves, as long as they can say yes or no. Answer B, the client's legal guardian. Explanation. This question addresses obtaining informed consent for clients who may lack the capacity to provide legal consent themselves. While you should always attempt to gain assent, agreement to the extent possible from the client themselves, not just yes/no. D, legally and ethically, if a client does not have the capacity to provide informed consent, as is often the case with severe intellectual disabilities, you must obtain informed consent from their designated legal guardian. Consent from the guardian is required before initiating services. Question 33. Which dimension of behavior is most relevant when measuring the force with which a child closes a door? A, frequency. B, duration. C, latency. D, magnitude/intensity. Answer D, magnitude/intensity. Explanation. This question asks about measuring the strength or force of a behavior. Magnitude, or intensity, is the dimension of behavior that refers to the force or effort involved in a response. How hard the child closes the door is a measure of the magnitude of that behavior. Frequency is how many times they close it. Duration is how long the door is closed, or how long the closing action takes. Latency is the time until they start closing it. Magnitude specifically captures the force or intensity. Question 34. A behavior analyst wants to increase a client's spontaneous requests, MANs, for items. They decide to use a variable ratio, VR, schedule of reinforcement for requesting. What is a potential reason for choosing a VR schedule over a fixed ratio, FR, schedule for this goal? A, VR is easier to implement consistently than FR. B, VR produces less pausing after reinforcement than FR, leading to more consistent requesting. C, VR is more resistant to extinction than FR. D, both B and C are valid reasons. Answer. D, both B and C are valid reasons. Explanation. This question asks about the advantages of using a VR schedule for increasing a behavior like requesting. Both VR and FR schedules deliver reinforcement based on responses, leading to high rates. However, VR schedules, based on a varying number of responses, produce less predictable reinforcement and therefore typically result in less pausing after reinforcement compared to FR schedules, which often show a pause right after reinforcement. This makes VR schedules produce more consistent, steady rates of responding. B, VR schedules are also known for being more resistant to extinction than FR schedules. C, meaning the requesting behavior is more likely to persist over time, even if reinforcement becomes less frequent. Therefore, both less pausing and increased resistance to extinction are valid reasons for choosing VR. Question 35. When conducting a preference assessment using the multiple stimulus without replacement, MSWO. Method. How are the stimuli handled after each choice is made? A, the chosen stimulus is removed from the array for subsequent trials. B, the chosen stimulus is returned to the array for the next trial. C, all stimuli are represented in a different order for the next trial. D, the chosen stimulus is delivered as a reinforcer and the assessment ends. Answer. A, the chosen stimulus is removed from the array for subsequent trials. Explanation. This question asks about the specific procedure for the multiple stimulus without replacement, MSWO, preference assessment. In MSWO, an array of stimuli is presented. The learner selects one, and that chosen stimulus is then removed from the array before the next trial begins with the remaining stimuli. This continues until all stimuli have been chosen or the learner stops selecting. Multiple stimulus with replacement, MSW, would return the chosen item. This without replacement rule is the defining feature of MSWO.